After government shutdown-related delays, the U.S. Department of Health and Human Services and U.S. Department of Agriculture released new dietary guidelines today. Its recommendations will now shape the types of food schools serve, what doctors recommend to patients, and what can be purchased on food stamps. Ivan Rodriguez has the latest.
Every 5 years, Health and Human Services and the U.S. Department of Agriculture update the federal dietary guidelines based on the latest research. The new guidelines that go past advice, but also include some nods to HHS Secretary Robert F. Kennedy Jr.'s Make America Healthy Again movement, urging Americans to prioritize protein and healthy fats and limit their consumption of ultra-processed foods and added sugar.
The new guidelines recognize that whole, nutrient-dense food is the most effective path to better health and lower health care costs.
Officials say that following the guidance can help prevent the onset or slow the rate of progression of chronic disease, as well as lower health care costs.
30% of healthcare costs are directly attributable to obesity.
The latest update will include images of an inverted pyramid that puts meats and vegetables in the whitest part at the top, flipping a long-standing visual of the American diet and moving away from the circular My Plate.
Dietary guidelines shape dozens of federal feeding programs, including Head Start. These standards affect 45 million school lunches every day.
The new guidelines also tell Americans when adding fats to meals to, quote, prioritize oils with essential fatty acids such as olive oil. Other options can include butter or beef tallow. I'm Ivan Rodriguez reporting.
The updated guidelines raised questions among some experts who worry they put too much emphasis on red meat and dairy products, but also garnered early approval from some influential voices.